Our job role is to see people who are arrested and detained in custody. We see anybody from age 10 upwards, male, female, variety of ethnicities, backgrounds, cultures. That could be drugs, alcohol issues, problems with housing, social issues, relationship difficulties, basically anything that someone might be struggling with.
I would say we get to work with people who are generally forgotten about. So they're the people who don't turn up to appointments, they're the people who maybe don't have an address, so they can't be open to different services.
The aim of our role is we can put support in place for people, and that support that you've put in place leads them onto a journey of not coming back through custody.
A senior liaison and diversion practitioner tends to be based across Greater Manchester Magistrates Courts. So when we get a referral for a person, we complete a screening within the court environment to identify that person's needs. That's when we work together with the person to identify a plan going forward. In order to be a liaison and diversion practitioner, you tend to have to be from a social work, occupational therapy or nursing background, and the court and custody environment isn't the traditional place where you'd work within one of those roles. So it's quite difficult initially because you are using your clinical reasoning skills and your professional qualification in an area that you wouldn't normally use it. And what that does is it really allows you to advance those communication skills that you previously already developed.
As a duty team, we deal with all incoming referrals into liaison and diversion across Greater Manchester. We allocate those referrals out to our custody staff or our court staff, or if someone has left custody or they're not yet going to court, we as a community team provide those vulnerability screenings in the community. From those screenings, we then do onward referrals to other teams, including our own community engagement workers who provide low-level mental health support in the community and help people access services such as bereavement support, housing and drug and alcohol support.
It's very different to other jobs working within the custody setting.
Our working environment is very supportive. We have a great leadership team who are always available in person or remotely to offer support to any of our practitioners in custody or court, or admin staff, community engagement workers, anyone to offer that kind of clinical support but also personal support.
So I'm part of the senior leadership team, and what is really key within my role is the voice of lived experience. Our involvement service user carer roles are on an ad hoc basis, so they pay £10 an hour, and then we've got our peer mentor roles which are on a weekly basis and supporting people that are using our services at the minute. And then obviously we've got our paid peer support workers, peer support navigators, and giving that opportunity to support our service users coming through, holding a caseload and giving that support from their lived experience. You know, you can't buy lived experience, you've either been through it or you haven't.
There's no way I would have gotten to where I am now without the help and the support of the team that I was with. These people, like I said, they showed me the care, they understood me. Do you know, like more than anything, they took the time out to want to understand me and want to care about me, and that's what seen me through. They got me back into work. I've gained a lot of support there as well. When I went onto the Greater Manchester Mental Health webpage and found out that they do peer support work and within the Manchester region, do you know, like, I thought that's something I can do. Do you know, like, why not give back what was freely given to me? I applied to be a volunteer to work with Greater Manchester Mental Health, and I got involved with the volunteering for that lead role in peer support mentoring. I met two lovely people there, do you know, like, who's really helped me as well from there. Do you know, like, they've supported me and they've kind of seen me through.
So this is probably the safest job I've ever had. We don't see people on our own. There's always another member of staff there, and we will always be dictated to by the sergeants and the custody staff as to whether we're allowed in a certain area. We're just very looked after, very, very looked after in custody.
Because liaison and diversion covers the custodies and courts across the whole of Greater Manchester, twice a day there's a meeting online where all members of the team get together, discuss any difficult cases, anything that might have arisen, ask for advice, etc. We also have a duty practitioner who's a clinical lead who's on shift every day from 7 till 7, which is the times that the service runs. They're available for all the custody staff and all the court staff to ask for some clinical advice, some guidance, and that's something that's always available for the staff throughout their shift.
I wouldn't hesitate to just say join the service. You're learning all the time, you're learning new skills. You start off as a band 4. If you are a qualified practitioner, you'd become a band 6. There's leads in the role which would be band 7s. So that opportunity for progression is within the trust.
I've been with the service for just nearly 5 years now. I love it. I love the service. I love what we can do for people. I love the amount of support that we've got behind us. There's always someone on the other end of the phone if we need them. The support that we're giving people is something that they can't get anywhere else. They can't go to their GP and get an engagement referral. They can't get what we can give them, and that's what keeps me here, is the support that we can give people through some of probably the difficult times in their life.